So anyway, I'm Judy Cornett, and I've been a speech and language pathologist for 49 years, and I specialize in communication. And then today we're going to be talking about how communication can be facilitated as you age through the natural process and then through any kind of neurological impairment that might be accompanying that. And we have a tiny little group today, so I was wondering if maybe Judy, you could introduce yourself and tell us what you'd like to get out of this class.
I'm Judy Gaston. I'm a retired nurse, and hearing issues have been part of our family. I presently wear hearing aids, and as I was talking to Judy before, I go to Dr. Waterman, local audiology, and she really was stressing the importance of the brain and hearing, and that was a new item to me. So I've certainly been encouraging folks to get a test and see where they're at.
Okay, Anne?
Well, I live in St. Michael's, and how shall I say this? My husband and I don't always communicate, not emotionally, but through the sound waves. And so I want to, see what I can do to help with that.
Okay. Peggy?
I'm Peggy Ford. I live in Easton, and I have a friend named Judy Cornett, and here she is. And she has been kind of telling me for a while that just to be very careful with your hearing and how everything in your brain is all that. She was very high over my head, but I'm trying to heed her warnings. But also, I think this is important because after, or now we're still during COVID, I felt very isolated, and different communication skills have probably disappeared. So I'm kind of interested in that type of thing, not practicing.
All right. And Charlene?
Okay, I'm Charlene Brooks. I'm the manager here at Brooklyn's Place. I am originally from Whitman. I was sent this information, and first of all, when I saw Judy's name, I figured I had to take the class.
Absolutely.
But of course, she would come back to haunt me if I didn't. But I think it's a very interesting topic. I too wear hearing aids, so hopefully this will help. And hopefully it's something that, maybe we can bring some of the information to some of our members that are here. Thank you.
All right. Well, great. That sounds perfect. Okay, so mainly what we're going to talk about is the transaction between two or more people. But I'm really going to talk a lot about cognition, because cognition is the basis for communication and language. And sometimes, like Judy had said, if we don't use it, we lose it. And you'll hear that quite a few times throughout this little class. So the first thing I wanted to show you is similar to like a Venn diagram, so that you can see all the different aspects that are connected simultaneously in order to produce good, effective communication. Cognition being the most important. Hearing is something that is more of a sensory input, but if we don't have the neurological connection, you're not going to be able to understand what's being said or communicate back. And so we'll talk a little about the cognition. The emotional control and self-regulation is also a huge aspect of whether or not you can communicate functionally with others and they can communicate with you. And then of course, communication. And what we're going to talk about a lot is this social interaction and how important it is to socialize and put yourself in situations where there is ongoing communication. Peggy, you made a really good point of the pandemic affecting that. And we need that stimulation in order to maintain the communication skills that we have developed over the years. And then the last part is the physical, which is normally something that is affected if there's a neurological disorder. If there's a stroke or aphasia, those different things, there's more of a physical aspect to it. And please, like, interrupt, ask questions, any point. So presbycusis, let's see. I think we can all relate to this. Yep. And so presbycusis is, okay, if I got my thing right, it's typical aging process. It's when the hair follicles in your inner ear start to disintegrate as we age. And it's normal, it's part of getting older, but it needs to be addressed. And it's interesting to me, I did some research, and 1 in every 3 people between the age of 65 and 74 have a hearing loss. After the age of 75, that increases to 50% of the people who have some kind of a hearing loss, which creates in itself a feeling of isolation. So the first thing we want to do as enablers or as people who are here to support other people is to recognize the signs. I also wear double hearing aids, and my indication, there were 2 things. I would sit in a meeting and I would have to concentrate so hard on what the people were saying that I was just exhausted at the end of the meeting, whereas it didn't used to be that difficult. And the other one was my daughter, who would come in and say, "Mom, why do you have the TV that loud?" And, you know, I didn't realize that I had it that loud, but she walked in, she was like, "Oh my gosh." So difficulty understanding words, trouble with consonants, because if you don't hear the consonants, you're not going to say them distinctly. Muffled speech, and this is me, excuse me, pardon me, all the time. So you're asking for clarification. So here we get with the cognition. So untreated hearing aid is bad for your brain. Hearing is a cognitive action, and you can lose those neurons, those dendrites easily if you're not constantly stimulating your hearing. And Peggy, that's part of the pandemic that has happened to a lot of people, is they just haven't been able to utilize their communication skills. And this is a little more kind of so you can kind of see what's going on. So the dendrite, these little ends right here, the axon, is what conducts between neurological connections. So the dendrite growth is stimulated by activity. The more you use it, the stronger it becomes. On the opposite side, dendrites have their own pruning system. So if there's a lack of stimulation, they prune themselves back or they atrophy, which makes it even more difficult if you start wearing hearing aids at an older age after you've been dealing with hearing loss all that time. And that's why some of the elderly people will be, I can't stand these hearing aids because their dendrites still need to grow back. So that, that is something that I don't think a lot of people are aware of, the cognition aspect and the neurological aspect. So the first thing is for yourself or for whoever you are caring for is to get a real audiological evaluation. And they can test how you receive sound and noise, whether you're using bone conduction or more of your inner ear. So getting a test is really essential. The other thing is, if you are supposed to get one, get a hearing aid. And there's all kinds of hearing aids out there. When you go to an audiologist, they will allow you to trial some different hearing aids. I trialed the one that was behind the ear, and it drove me crazy because I have a habit of doing this all the time, and I could hear my hair moving, and it was driving me nuts. So I got the inner ear one. And so picking out the right hearing aid that works best for you is really important, and your audiologist can help you do that. Oops. And then what to expect. Because as soon as you put those hearing aids in, it's not going to be easy peasy. You're going to have to get used to that feeling. One of the feelings is you have a learning curve. So you're going to hear, and this happens with me, if you're in a loud crowd, you're going to hear a lot of that background noise that you didn't used to hear. So that's going to challenge you cognitively also. Then there's that occlusion effect, like that weird feeling I've got something stuck in my ear. And that's very real, and it's just something that we have to get used to handling. So my thoughts is, don't start out wearing your hearing aids all the time. Wear them as much as you can and as much as you feel comfortable. And I'll be honest, when I'm at home sometimes, I don't wear my hearing aids. There's nobody else here to hear that loud TV, so I give myself a little bit of a break. And that's important. Take a break if it becomes overstimulating to you. And then spend time having conversations. I know, Peggy, you do a lot of audible books, and that is a great way to stimulate your hearing and your hearing sensitivity and stimulate the growth of your dendrites and neurons. Talk on the phone, read aloud, anything that will stimulate that aspect of your brain. And then gradually practice going out into situations that have a lot of background noise and work on, where you want to put yourself in a situation so that you can hear the best. Everybody's different. Everybody has different levels of hearing in each ear. So whatever works for you, but realize that it's not going to happen overnight. So what can you do if you are the one with the hearing loss? Tell your friends and family. I tell my friends all the time, you're going to have to speak up, or let's go over here and talk because I'm receiving a lot of noise. I have a challenge, and if we just finished a log canoe weekend, I have a challenge on the boat because my hearing aids pick up the wind. So standing somewhere on the boat that is out of the wind helps me to hear better. So ask them to face you when you're talking. Pretty easy, but you are going to pick up on a lot of body language and facial cues if you're able to actually see the person who is speaking. Turn off the TV or the radio if you're not listening to it. So when you go to a restaurant, for example, don't sit near the kitchen, don't sit near the bar. Also, don't sit under a hard surface like a mirror or a window, because that does not absorb the ambient noise. So you're setting yourself up to hearing more and more of what's going on. And position yourself so that people can see where you are. The other thing that you want to consider when you get hearing aids is cell phone use. And my hearing aids do not have this technology, which I wish I knew at the time that it was available. It's called a telecoil. And what it does is it takes the electromagnetic energy that is being put out by your cell phone and turns it into the energy, the hearing energy, and the audiological vibrations that will stimulate your hearing and will allow you to hear better on the phone. The way I realize that is now I usually have to have the phone on speaker so that it can go from the cell phone into the air, and then I get the information. Same thing happens with the Zoom. It's much easier for me to talk to people with Zoom because I can look at their facial features and I can see how their expressions are being presented facially. So using Zoom, using FaceTime, and asking your audiologist for the telecoil, which will help in that area. So that's something I didn't know. So I've kind of educated myself, and when I have to replace my hearing aids, I'll be getting that. So what can you do as the partner? You can look at the visual impact, the environmental impact, and the community activities. So make sure that the listener is attending to your face before you start to talk. If you turn away and then start to talk to them, they're not getting the cues that they need to be able to attend to what you're saying. Don't stand in front of a window, large pictures, or mirrors, anything that's got a hard surface that doesn't absorb noise. Do try to sit near places that have like a tapestry or rugs or bulletin boards, something that will absorb some of that background noise so it doesn't interfere with your ability or their ability to hear. Decorating your environment in round spaces. And that's really important. Yeah. So look at the difference between a linear meeting, which is on the bottom of the screen, and how you have to really strain and look to pay attention to be able to hear, as opposed to the round table that lets everybody see everybody else's faces. This is what my first indication that I was having trouble with my hearing was, because all of our IEP meetings and PPP meetings were all at those long tables, and it just got more and more difficult. So try and use a round table, or arrange your home in a rounder aspect rather than a lot of 90-degree angles, so that you're increasing that ability to focus on each other's faces. Any questions about the hearing that I haven't touched on?
Yes,
Yes,
yes, I do have a question.
good.
You mentioned wearing them out on the log canoe, and I know that's a potentially wet environment.
Yes.
I swim a lot.
Uh,
What about the wet environment?
if I'm in a wet environment, I take them out, because there's nothing you can do. I'm on the chase boat, so I'm not swimming.
Oh, okay,
Oh,
okay.
But even on a sailboat, if it's really rocky or there's a lot of wind, I'll take mine out. But yes, like on the chase boat and being race committee, you're moving, but you also have to be able to hear and respond to what's being said. So it is a challenge, and I had to kind of get used to it. It was one of those things I just had to orient myself towards. Good question though. So. Natural aging. So what is that? It's this. It's occasionally misplacing things. It's struggling to find a word, and then 10 minutes later, poof, the word pops into your brain. It's forgetting most recent activities, but remembering long-term activities. That, and we'll talk about more about this, but that is the difference between a working memory and your long-term memory. And the working memory is the most difficult to retain. And that's what you're hearing like right away in this instant. So that's all natural. It's the way it is. And there's many times that I've been like, oh my gosh, do I have dementia? But no, it's natural. It's the process. So I kind of thought that was pretty funny.
That is funny.
Yeah. And like I said before, communication skills are directly related to the health of your brain. And the health of your brain is directly related to your environment, your stress levels, your cognitive load, which we'll talk about, your cognitive reserve, which we'll talk about. It's all connected. So here's what happens to our brains as we age. Same thing, same picture. The dendrite growth is stimulated by learning, taking these kind of classes, engaging in doing research, anything that, taking classes at Chesapeake College or online classes are going to stimulate and maintain that dendrite growth. You don't use it, you're going to lose it. That's the way the dendrites work. It's the way your brain works. So I can't say that enough. Part of your brain's going to shrink if you don't use it. So also as you age, your blood flow is reduced as you age. And that affects your brain also. So you almost have to work a little bit harder at having a healthy brain as you age than you did in your younger years. So one of the things to empower your brain and increase your blood flow is to get exercise and get vestibular exercise particularly. And here's the reason. Whoop. Boom. Okay. So your vestibular, your balance nerve, and your auditory nerve, your cochlear nerve, come together as they enter into the neurological aspect of your brain, the vestibular cochlear nerve. So it makes sense that if you stimulate your balance, you're going to stimulate your auditory processing. This has been researched, it's been proven. I was working closely with a physical therapist with students who had some real communication difficulties, and she would swing them, then stop, and then have them respond to a question or explain something. Swing them again, stop, and have them respond. And the difference was amazing. And so what we can do is all of these exercises, yoga, just sitting on a swing, rocking in a rocking chair, I do a lot of water aerobics, which is really good for your vestibular system. And I found I was thinking about it when I was on the chase boat, instead of sitting on the boat, stand on the boat, because you're constantly moving and adjusting your balance, which means you're constantly stimulating that cochlear nerve that is going to help you to regain or maintain your hearing. So I mentioned briefly cognitive load. Oh, I did that wrong. Okay, mindfulness. Let's talk about mindfulness. I practice mindfulness. It's really easy. It takes like a minute or 2 minutes to do. I know Peggy practices also. So let's try this a little bit. Let's look at this and concentrate. Now close your eyes. How does it smell? How does it feel? What is it bringing back to you in terms of your senses? Hearing the waves, hearing the rhythm, feeling the sand. Open your eyes. Did that reduce some of your stress level? It does for me. And I do it, you can do it when you're sitting in a red light, just looking around in this beautiful area that we live in, noticing the trees, taking time to let your mind de-stress. That's so important. So what is your cognitive load? Okay, so your cognitive load is what's going on in your brain, both your working memory and your long-term memory. So your working memory is what you're getting right now. You're listening to me, you're taking in new information. Your long-term memory, and we find this in many people as they age, is they can tell you events that happened when they were 30. They can tell you stories about playing in the college games, but they can't remember what they did yesterday because the working memory is weak. And if your cognitive load is too great, if there's too much going on, then you're going to reduce your ability to utilize communication skills, to focus, to respond. So your working memory is the one that is most vulnerable to overload. Things that you see, things that you hear, things that you touch, they all have to be filtered. And as we get older, those filters are weaker. So we have to work on decreasing all of that other information. And this was most obvious to me when I worked with communication delayed autistic adults. Whereas if they were in a calm, non-stimulating environment with maybe some calming music in the background, they were much more able to attend to what we were doing and attend to the lessons that they were engaging in. So what we want to do is decrease that overload, which can be sensory, all kinds of things. One of our biggest trials or challenges is confusion. And I know, Charlene, you must get interrupted a million times a day. And right now, or, you know, when we were younger, we could handle that and we could go back to what we were doing. But because our working memory is not that great, that means that you're going to deal with that interruption, and then it's going to take more cognitive effort to get back to what you were doing. You're going to have to retrace some steps. You find yourself doing that? Yeah.
Yes, quite often, yes.
Yes. So some of the things that I do for that is I might put a sign on the door, you know, unless it's emergency, please don't disturb. Or I'll tell people, you know, I really need to get this done. I'll be with you in a minute. But we have to recognize when there's a lot of interruption, we're going to get more confused and less focused, and we're not going to be able to communicate as effectively. So one of the things that I like to do, and people like with aphasia or people that have had neurological difficulties, they have trouble with remembering where things are. So establishing routines early on, before that memory loss seems to get weaker, is to just establish a routine of where you put things all the time. I know, Anne, as an SLP, you're probably right in there with me on that.
Yes.
Yep. And so instead, so some people have trouble, and they have trouble with picking out what they're going to wear. If you want to help them, organize their clothing by association in complete outfits. Because when you first wake up, if one of those cognitive challenges is to make this decision, it is going to impact your ability to communicate because it's going to add that load onto you. Another thing is remembering to put in your hearing aids. Yeah. So for me, what works is I associate it with what I do every morning. I would never leave my house without brushing my teeth. So I put my hearing aids right next to my toothbrush. So there's my visual aid, and I won't go out forgetting that I didn't put in my hearing aids. Your keys. This is what I do. I keep my keys clipped to my purse because I wouldn't leave the house without my purse. Another thing that people do is to put the key around the inside doorknob. So there it is all the time. But having that structure helps you to reduce your cognitive load and helps you to be able to engage in other cognitive activities like communicating. So any other ideas of associative prompts that you guys might find useful?
What do you do about finding your phone?
You get your landline and you call yourself.
That's a funny pay because one feature on this iWatch is Find My Phone. And that's the one I probably use the most. So it pings my phone. But it's true because now that we don't have a phone just located in the kitchen, it goes everywhere with us, and we put it down in one room, and yeah. So I use that, but that's a problem. That's an issue. Yeah. So this is where I got my slides mixed up. Interruptions, which we already talked about. Write things down. I write things down all the time. Just jot myself a little note, and then I can come back to that interruption. So let's talk about cognitive reserve. And you guys are all right where you need to be, because cognitive reserve is based on long-term memory skills. So the more that you engage in stimulating and educational experiences, the stronger your brain is going to be. And if something happens, if there is a neurological disruption, you're going to have more reserve to pull from. So it's essential that as we age, we continue to learn and we continue to put ourselves in that situation where we're learning new things or gaining new skills. And it's really essential. It's kind of like saving your money for the rainy day. Peg.
Well, and I'm back to COVID again. I mean, there's a fear factor in the last 2 years of, trying something new or, stepping out. And now I think maybe I'm speaking for myself, just trying new things I might be doing, but I'm not back to where I was before. But when I am able to do something that's a little out of the ordinary, and I just feel so good because I feel like, yay, I did something new, and I stepped out, and I give myself a little, pat on the back and, gold star and all that good stuff. But
yep. Yeah, that's so true. Just having new experiences and accepting invitations for things that maybe, you really didn't go to before, and doing it safely according to your own health risks. But yes, I totally agree. And that it's been interesting as I work with younger children, that children who are now entering school or are in first and second grade who really were impacted by that COVID and not being able to associate with other children and learn these social skills. And I'm also finding it with the adults that I work with. Their skills drop dramatically in the area of social skills and social communication skills because they haven't done it. And then back to that whole neurological aspect of it, if you don't do it and don't stimulate it, it's not going to happen. But you're absolutely right, Peggy. I think the impact of the pandemic is long-term, and it does affect our ability to retain our cognitive skills and also to communicate effectively. So that's true. Okay, so let's talk about the environment, and let's talk about a soothing environment. These are things that I use. I really encourage my patients to become super organized, so they have less of a challenge when they're getting ready to do something. I use color therapy and I use aromatherapy. And, in the beginning, when it was like back to the hippie stages of using those kinds of things, I had my doubts. But then it turned out that for me, I would have my office set up, especially when I was working with adults with disabilities. And I'd come into my office and there'd be people just, some of the people just sitting there because it was relaxing and calming for them. Because I used the colors and I used the aroma and I presented an area that was not cluttered. So that, I really believe in that. So tell me, what does this color stimulate in you? Judy?
Oh gosh, energy.
Mm-hmm. And?
That's the word I was going to say. Stimulation, being alert, being ready for action.
Yep. Peg?
heat.
Good. Charlene?
This is crazy, but I look at that and I think anger for some reason, the rage.
Yep, absolutely. Red, these darker alerting colors, they are alerting and they can be used in that way. I had a patient who was having a lot of trouble with appetite as they were aging at post-stroke. So what we did is we put a red placemat on the table, and that helped him to be more alert to the food on his plate. But typically that color stimulates the thoughts of anger, fear, distress, also alertness, and also attention. Now, if you want to increase your cognitive stimulation, this is a great color to use. But what does this color stimulate? Judy? Yes.
Calm.
Yeah. Peg?
I think of water and a lake and
Yeah. Charlene?
Well, I'm gonna have to agree with Peggy on that one. You know, it's a calm blue water.
Yep. Yep. So think about your environment and think about the elderly person or the patient and the environment that they're in. Are the colors alerting, which can be stimulating, but can also create anxiety, or are the colors calming to give them the ability to reduce that cognitive load and pay attention to what's going on? So using colors definitely helps. Whoops, wrong way. So here's kind of and you can look this up on the internet, kind of the scheme. And if you notice, if you go into a hospital, you see a lot of green and a lot of blue because they are the healing, calming colors. So, and the interesting thing too is as I work with adults who have some neurological impairments, having black lettering on green paper or background is one thing that will help them to follow a course of action. And we'll talk more about that. Also to have what? No question? Okay. In the room that the elderly person is sitting in, have a focal point. These are two examples from my house. In my in my office, this is my focal point. It's calming. You can't really see the blue, but that is facing me when I'm working at my desk. So it gives me that feeling of calm. In my living room, it's this. You've seen it, right, Peg? Yep, and that really does work for me because of the blue, of my long-term memories of being at the lake with my family. You know, it brings out all those positive feelings. So, you know, very subtly, you can just add a focal point into what you're working on. So, for example, Carlene, I'm going to use your background as an example. All of these books that we see in the background, for a person who's having trouble communicating, that would be very visually distracting. And
Okay.
no, I'm just saying
Yeah.
that's why I chose like to sit out here to do this, because hopefully this is less of a visual impact. And so it's easier to concentrate on what's being said and what you need to do in order to keep in that conversation and keep your communication forefront. But that's just an example, and that's your office, and you're not facing it.
And I don't have a lot of room here.
No, but I mean, I
know, just-
think of it in the way of what do my patients do?
Right.
And that's, you know, especially when, you know, if I'm going to do a visual schedule for a patient with aging skills, I'm not going to take a picture of a huge scene. I'm going to take a picture of the entranceway and crop it so there's nothing else in the picture. Because if you don't do that, you're increasing their cognitive load because there's all that visual stimulation going on. And so it's just a technique that is used, especially when you're dealing with somebody who has communication difficulties. Aromatherapy. I also use a lot of aromatherapy. So, and the interesting part about this is what I found out while I was doing research for this class is that your final stage in sensory processing, you're getting visual, you're getting, you know, what you smell, what you hear, all of this is coming in, and the final stage of it is what you smell. So that goes right to the thalamus, which controls your emotions, and right to the amygdala, which controls your emotions. So if regulating emotional responses, to do it instinctually is just to provide that kind of stimulation in the background. And everybody has different music or different sounds or different aromas that help them to soothe. And body oils, creams, it helps you, I'm looking here, inhalers, bathing salts, all of that is going to calm your cognitive level and help you to be able to engage in more difficult cognitive tasks, such as communication. All of our communication is one of the areas, communication and speech, that is not part of our human basic makeup. That is just cognition. So using different oils helps. I usually use, for me, I'll use, in my therapy room, I use lavender. All right, I'm sorry, when I'm working with someone who has auditory processing difficulties, I use lavender. If I want a student to pay more attention, I'm going to use lemon, because lemon enhances your attention and improves your attitude. Lavender is more of a healing process. Peppermint is really great when you want to invigorate something. So using peppermint, or using peppermint mainly during a conference where you want to keep people alert, or when you're engaging in a group communication activity, having a little bit of that sense, that aroma in the background, is going to help people to invigorate their brains, is going to help them to attend. And essential oils are huge. Let's see. And here's a website that you can look at to give you more information. And here's kind of another format for you to look at. So knowing your client, knowing your patient, knowing the person that you're giving care to helps you to find out what oil, what aroma is going to be best for them. So memory and learning, we use a lot of this in the classrooms. I use a lot of this when I have a patient that really needs to work on their attention and their focus. And you'll find the same oils down here for attention. If it's a disruptive kind of student, a lot of my younger clients who have autism have some real behavioral issues. So using these colors here with the lavender and the chamomile helps them to soothe themselves in the natural environment. Say uplifting your mood, lavender again, lavender's a good one. To decrease your worry using lavender, just having it set up in different areas of your house, at least that's what I do, or in the meeting rooms that you're going to have. Oops, wrong way. Music therapy, yes, Anne.
Judy, I just like to mention the most, using essential oils versus some candles or artificial kinds of scents. I just want to warn people, for instance, people like me who are very sensitive to any petroleum-based products, which are in some candles, et cetera, can be very unpleasant for that person. So
Yes. Oh, thank you. That's a really good point. Yes, using true, pure essential oils is going to get you the result that you want. You're absolutely right. And as I said before, it's different for every person.
sure.
I mean, I walk into a spice shop and I love it. I have friends who stand outside by the door and I'll wait for you.
Yeah.
So everybody has different comfort levels with that. But yes, using the true essential oils is very important. Thank you. So music therapy. This is something that kind of came to the forefront I'd say a couple decades ago. There are different kinds of music that produce theta and delta waves. And that kind of music is it's called binaural hearing. And it's when the music that's being presented, it's really most effective using headphones, but you don't have to use headphones for it. It connects the right and the left hemisphere. So 1 decibel or one frequency and another frequency that are being presented at the same time will help to increase your theta and delta waves. And I hope that this works. Are you guys able to hear this? No? Darn. Now? Oh, let's see.
Do you want to hit the start, maybe?
I think that, no, I don't want to change my wave browser. Oh, I don't want that.
Sorry.
No, that's okay. It was a good idea. Okay, let's see. Let me get back to where I was. Good morning. Okay. All right, let me get back to my PowerPoint. There it is. Well, I'm sorry that you can't hear it, but if you go to this website, you ought to be able to. And it's kind of like the music if you go to get a massage. It's kind of like that kind of just soothing, quiet music. And it's used a lot in like waiting rooms, doctors' waiting rooms for people who have high anxiety. It's also used I use it for stroke patients or aphasia patients who just have that high level of stress because they cannot, their cognitive load, the stress that they're having over their condition and their inability to communicate overrides anything that else you could do to help them to communicate. So let's kind of get into that. And you'll see some of these are repeated. So let's see. Deep breathing helps. I'm sorry you can't hear it. I try. I can never figure out how to do those. And if you want me to send you a copy of this PowerPoint, there's all of the websites that I use for the research. So let's talk a little bit about when neurological damages get involved. Aphasia. So, Chaldine, I bet you have a lot of people who come to your center that are suffering from some level of aphasia. And what aphasia is it can be the result of neurological damage like a stroke, but it also can be progressive aphasia. So there's 2 different ways of treating it. Mainly with my patients, they know what they want to say, but they're not able to get the words out. And people who have had a stroke or other neurological damage done, what my therapeutic attention is, I'm not going to cure them, but I might be able to give them enough stimulation for them to retain and maintain the information that's important to them. So what I do is really focus in on, one of my recent patients with progressive aphasia, she wanted to remember her name, her address, the names of her grandchildren, the names of family members. And for her, she's a bird watcher. So she wanted to be able to remember those names of the birds that she loved to watch. So that's where my therapy was focused. It wasn't to regain or heal the brain, because after that kind of neurological damage, that's not really going to happen after the first 6 months. So depending on what you want, what they want to learn and to retain, and that would be what the focus would be. It's very common, and it changes with the level of severity. Some people just have word recall problems. Some people have severe reading, not being able to read, difficulty speaking, not being able to spell. And it's very distressing, especially to people who had a very vibrant life prior to the neurological insult. So one of the things that we do as support is just listen and make sure you have eye contact. And one of the things that I use is I use a lot of the apps on the iPad. And one of them is called Pictella. And Pictella can be, it's like a visual scrapbook, but it also has auditory input. So you can, for one of my clients who might be going someplace like a family reunion, and they want to be able to remember the names of the people at that family, I'm going to put it up on the Pictella app, and I'm going to record, this is my great Aunt Nancy. I remember when we did such and such. In the next page, this is Nancy's daughter. Her name is Susie. And the client would read that story and listen to that story over and over again, so that when they get into that situation that they know they're going to get into, they have that in their cognitive reserve. And so it's really easy. It's a great app, and it's really easy to use. The other thing that is really difficult for us who do not have this difficulty is to allow the communicator to work around finding the word they want to say. So, you know, that fruit, that, you know, that long is, you know, you eat it for breakfast. Instead of me jumping in and saying, oh, you mean a banana? I may say, oh, buh, to start with buh. And sometimes that will get them right on and able to find that word, and empower them with this ability to talk about things. It's called circumlocution, and it's a skill that demonstrates that they know what is associated with the object, but at that time in space, they can't come up with the word. And so waiting and listening and giving them the cues that they need instead of anticipating what they want to say, because anticipating it is going to cause them to not try as hard to find the word. My patient with aphasia always mixed up the pronouns. You know, she would talk about her husband, she did this and she did that. And you know, it's okay, because I know who she's talking about. So one of the things we want to remember as people age is to not overcorrect all the time, because their message is more important than how they're saying it. And if you understand what they're saying, some of these little things like missing words or using the wrong pronouns, let that go, because if you're continually correcting them, you're adding more and more to their cognitive load. And then they're going to get frustrated, and they're either going to get angry or they're going to shut down. So making simple accommodations. Okay, auditory processing, we talked about that a little bit. And I'm a huge proponent of the 13-second rule, especially with people who have word recalling difficulties. If you allow them 13 seconds to process what you've asked without interrupting them, they may take a while, and for us, it may seem like it is forever. But eventually they come up with the answer, or they come close to it. The other part of it is, if you're asking them a question and they don't respond right away, don't change how you ask the question. Where do you live? Okay, what's your address? Now they're having to process that information all over again. So the cognitive load is just increasing and increasing. Changing the emphasis, you know, where do you live? That's going to change it all over again. And it's all things that we do for these people that we love because we think we're helping them to grasp the question. But if we don't give them time to process it, we're really providing more of a cognitive load and more frustration. Keep things short. You don't need to elongate all of these things. You don't need to use a whole bunch of modifiers or adjectives or adverbs based on the ability of the person to maintain that working memory. You know, based on that, you kind of get a feel for the person. If you use a lot of adjectives and modifiers in your sentences and they're confused or they're not able to follow the direction, just shorten it, but don't dumbify it. And don't treat them like they're not able to understand. Another one of my patients who had a stroke fired their first therapist. And so they came to me, and the first thing that they said to me in the way that they could was, she called me honey and sweetie, and I am not her honey or sweetie. So she was angry that she was being talked to like a child. So refraining from that, which is not always easy, but making sure that you're talking to them on the level of cognition and the age that they have. The other thing is using visuals. Visual support will help them to communicate and anticipate and not lose because of that cognitive overload. So I use a lot of visuals. As I said before, I try to keep them really clear without a lot of background noise going on visually. And I try to make sure, for example, this may come up again, I can't remember exactly where I have it. One of my elderly people who I work with, her daughter, and she had the right idea. They had a visual calendar and she would do little stick figures. But her mother, the woman that I worked with, would get so frustrated because she had no idea what these meant. She also would write it in, dentist. Well, with aphasia, if you're having trouble reading and you're having trouble spelling, you see something on your calendar and you're like, okay, something's going on. I don't know what it is. I'm going to be upset. It's going to affect my ability to focus, to communicate. So my solution, which worked for this particular patient, was to take a picture of the dentist, take a picture of the door to Panera Bread, take a picture of what they would see visually, crop out all of the extraneous stuff in the background, and use that on their calendar. I had a phone call from this particular woman's daughter saying, Mom is refusing to get in the car. She won't get in the car. I showed her where I wrote your name on the calendar. And so I said, okay, I'm going to send you my picture to your phone. Sent the picture. Her mom saw the picture, immediately got in the car, because that visual input is what she needed. So using visuals like that. Some people in the educational world think of them as crutches, but they're not. They are what we use every day. We just don't realize the significance of them until we have difficulties with our communication skills. Another thing is, I'll get into more of that. So a lot of people ask, what's the difference between dementia and Alzheimer's? So Alzheimer's is actually an atrophy of your neurological system. It's irreversible. It's going to progress. So you change how you work with these people at the level that they are demonstrating skill on that day. And like all of us, some days they're better than the others. So they may be able to do it today. Maybe they won't be able to do it tomorrow because their cognitive load is higher and increased, and they just can't do it. So saying something like, you did it yesterday, I know you can do it, is extremely frustrating to them because they know they could do it yesterday, but they can't do it today. Dementia has a lot of different causes. It could be a stroke, it could be something with your thyroid, it could be vitamin deficiencies, it could be the medication you're taking. And some forms of dementia can be reversed. And those are the ones that we will challenge the individual to learn more and do more. We will kind of push the envelope a little bit because maybe we can help them to strengthen their neurological connections. So there's a big difference. Oh, and drugs and alcohol, that's huge also with dementia. And that's how they feel. Okay, so my brother, he has a neurological impairment that he acquired when he was serving in Vietnam. And he has no short-term memory. His working memory does not exist. So he writes everything down. He just keeps a spiral notebook with him. I took my meds. I washed the dishes. And then I call him like every other evening and I'll say, what did you do today? Oh, let me get my pad. And he'll tell me what he did. And he feels very successful with that. It's not a crutch. It's what he uses because his working memory was so damaged. Another thing is what I call a visual schedule, because people who have trouble with working memory don't understand how their day is going to happen. That's going to add anxiety. That's going to add stress. That's going to decrease their ability to communicate. So a visual schedule, start out with breakfast, and then maybe we'll do some exercises. And then maybe it's time to Zoom with your friends. A lot of my patients either check it off after they've done it, or I put it on Velcro so they can take it off. And that way, if they take it off, they don't have all the stuff on the top to have for visual, just causes them more visual intensity. If they take it off, they've done it. So using something like that with somebody who has cognitive difficulties, it actually works. So also with food, one of the areas that is affected by your neurological development of your sensory systems as you age is your food choices. So if you have a client, I have a client that I was called in just on a short-term basis because he wasn't eating. He's an adult with some cognitive deficiencies and some neurological damage from seizures. And he wasn't eating. And so I went and observed him. And as soon as I put the food in front of him, he was, and what I heard was that he used to love this. This is his favorite food. And realizing that as we age, our olfactory system and our sense of taste changes. So don't rely on what you thought they always liked. Rely on watching them. And as I watched him, he wouldn't even put the food to his mouth because of what he was smelling. I did have a question with COVID. He did have COVID at one point, and I was wondering if his olfactory system was working the way that it should. Because I know when my other brother who had throat cancer and went through all of that, he lost his sense of taste, and he told me everything tasted like glue. Mm-hmm. Everything tasted like glue. So to find something that is flavorful to them, maybe adding a different scent, maybe using aromatherapy while you're having a meal, can help to reduce that which will cause more overload. Everything we do causes more cognitive overload, which makes us unable to communicate. What this young man did is he developed apathy towards food. He had no interest in eating, whereas before he would eat just about anything, but his favorite was hot dogs and mac and cheese. So we started to introduce some foods that had a little more spices, and he started to eat them. So just playing with it. And what I'm talking about, you might say, well, how does that have to do with communication? If you're not eating and your senses are overwhelming your brain, you're not going to be able to communicate, because communication is a secondary function of your body staying alive. So it's all related. You just don't treat one symptom. You have to look at everything. Hot foods, cold foods. We've come a long way with using thickeners for people who have swallowing disabilities, but some of them taste awful. So, just getting to know your patient. So another aspect of us as the caregivers in providing for an environment is to look at their behavior and to really look at it. And don't think of it as behavior. I think of it as they are communicating to me their level of anxiety or emotion, and it may be heightened at one time. And I know as you work with people that are aging, there might be a time of day where they're more irritable than other times of the day. That's not a time when you're going to want to add a lot of cognitive load to their schedule. And looking at going into like behavioral therapy and looking at what's going on around them helps. So looking for the why, not what they're doing, but why are they doing it? And let's see if it's in here. Okay, let's go through this. Understanding that their stress level it's not about you. And that was one of the first things that we learned when we're providing services to patients is their responses are not about you. They're expressing their emotions the only way that they can. Sort of like a baby. When a baby's anxious or stressed, they cry. Maybe they throw a little temper tantrum. As we age, that becomes a more viable mode of communication because it gets a response. So look at their body language, make sure all of their needs are being met, and validate their feelings. And I know this is really basic. I understand. Just a little, I understand, or that's really hard to do. And do it with your body language too. Look at them with sincerity, maybe touch their hand, whatever comfort they need. Introduce pleasant stimuli. I use a lot of different things that I know are going to calm my patients down. I have a patient who gets really upset with herself when she can't think of a word. So when she comes into my home, we work in the living room, not in the office, and I put a very soft pink blanket on the side of her chair. And I can see when she's starting to get stressed, she starts to stroke that blanket. And that eases her stress. And then she's able to maybe recall the word or communicate what she's feeling. So finding different things that will ease the person. And it all changes with each person. Aromatherapy, again, we've talked about. Health of lavender. Here are some examples of some picture schedules that you might want to see. Make your own. It's really easy now. If you set up a Word page, you can download any picture, crop it to what you want to have emphasized, to what this individual is going to use. I used a lot of online pictures for my aphasia clients. If they were going to go to a particular restaurant, you can go online, you can find the picture of the door with the name of that restaurant above it. Visualizing what they see, not inside of the restaurant, because that's going to be different every time. But thinking about what they see and what cues them in, it's really easy to do with the technology that we have. Communication systems, augmentative systems work for a lot of people. Some people feel that this decreases their ability to use verbal communication. Research has it that it is increasing their ability to communicate verbally. It gives them an out if they cannot find the word. And the essential idea is for them to actually communicate effectively with someone. So if something, a handheld device that has, voice feedback, vocal feedback, hi, yes, thank you, little things like that. And you can get as high level of technology or as low level as the individual needs. And a speech pathologist can help with that. And occupational therapists are really good with that also. I have always believed, and I think you will agree with this, working cooperatively with the OT and the PT when you're dealing with communication is essential, because they can see things from a different aspect. They can see things, it's just like learning about the vestibular motion from the physical therapist. It really is important to work with them and have them work together with you. So let's see. And I don't know if any of you have read Still Alice. Great book to get the perspective of somebody who's going through Alzheimer's. There's all kinds of books. Finding My Words is another one that helps. Living with Alzheimer's, just to kind of give you a feel for what it's like for them to attempt to understand what you're saying and to communicate back to you. It's a whole new world for them. And the things that we take for granted, like I can look at you, Chaldine, and that's the background books. I can filter them out, no problem. I'm focusing on your face. But somebody with more cognitive difficulties wouldn't be able to do that because they don't have those filters. The same with noises, the same with the environment. It all kind of comes together. Any questions? Anything that I didn't touch on? Any additions to the thoughts?
I did have a question that came up a while ago, and you mentioned that there's no more improvement in certain aspects after 6 months. Now, I'm a physical therapist. As for many years, we said that of stroke patients, you're going to see improvement up to 6 months. Suddenly, several years ago, so it was somebody's research or something, and said, or just observation, no, there can be very significant improvement, physically at least,
Yes.
after 6 months. Now, I wondered, that doesn't carry over to the communication aspects that you're talking about?
Well, it does, and you're absolutely right. Thank you for bringing that to my attention. You're absolutely right. The 6 months is where they're going to have the most recovery.
Yes.
And they're going to recover those aspects of their bodily needs first.
Mm-hmm.
Being able to walk, being able to feed themselves. The bodily needs are going to recover faster, and they will respond to treatment after that, not as quickly as they did in the first 6 months,
Right.
but they do make progress. Now, if you think of communication as a secondary function of our bodies, like our teeth, our tongue are not meant to be articulators. They're meant for us to eat, for us to sustain health. So having speech and using communication is a secondary function. So it's a little bit harder, but you're right. And there is improvement. It's really slow after a certain period of time. And the more physical therapy, I find my patients who have long-term physical therapy are making more progress than my patients who are only getting the therapy that the insurance pays for, which is limited.
So that falls in with what Dr. Broussard will be talking about tomorrow, when he talks about all of the things that he's had to do to regain his communication skills after those first 6 months or so where he got the occupational therapy. But I think that the idea that the more physical activity you get, the stronger your speech capabilities will come back is really pretty amazing.
It really is. And the research is coming out in loads in support of getting, that vestibular stimulation, getting exercise, keeping yourself active. And even, when we look at a child and how they develop, if they're developing physically, walking early, typically their communication skills don't develop as fast because their bodies are working on this physical aspect. So if you encourage it, walking alone or walking with somebody and having a conversation with them, wow, you're stimulating everything there.
Oh,
So
that's interesting, because I remember last year when Dr. Broussard was doing his presentation, he was talking about how he went walking, and as he walked, he would say words that he saw, and that really helped him.
Yep, absolutely. Yep. Or walking and listening to a book, an audio book.
Yeah.
I do gardening, which is kind of a brainless task. I listen to auditory books when I'm doing my gardening. And that's the exercise I like to get. But yes.
I try to remember what the plants are that I'm looking at.
Yeah. So the more stimulation you give yourself, and that goes back to your neurological function and your neurons and building those dendrites so that they're stimulated and they continue to grow and to become stronger.
I did not realize those dendrites were more than just hearing.
Oh no, it's every neurological connection. Yep. Yep. Yeah. And like I said, your whole body works together, which is why you have to deal with the environment. You have to deal with the cognitive level of overload. You have to deal with everything that is going on because you just can't focus in on communication. So anybody else, any other points? Anne? Oh, you're muted.
I did. I know I was getting notices about emails. So
Oh, sorry.
no. I don't know that I really have much to add. It was kind of, I always worked with children, so I didn't deal with a lot of adults with neurological difficulties, but certainly children with neurological difficulties. And I think the expectations there were held higher because the expectation as they grew, there was, how shall I say, more potential
Right.
for change.
Right. So you could do more challenging things and
right.
push that envelope
That's
because
right.
they haven't reached their full potential.
Right.
You're absolutely right. And that's kind of knowing your patient as they age, which ones are able to handle that kind of a challenge and need more of a maintenance program, or which ones are seeking that kind of a challenge.
Mhm.
So that's very important. You're absolutely right. Annabelle, anything else that you would like to add?
Can't think of anything right now other than the fact that I missed a lot of your presentation because my internet kept failing.
Oh, I'm so
Oh.
sorry.
So I'm going to have to go back and listen to the recording later because and that for my region of the county, that is not unusual.
Oh, okay.
3 times it went out while you were talking. It
Yeah.
took me a while to get back in.
Yeah.
I was glad that I was able to catch it. I'd never tried Zoom on my phone before, so in the car, moving down the 50.
And Bob can say great session too.
And Bob says it was a great session too. He was listening as well.
Oh, thank you. That's awesome. Judy, anything you wanted to add or?
I wanted to say something. I'm my own patient, so thank you for so I liked the parts that you talked about environment and colors, aromatherapy, and what can add to confusion is also I think you said like clutter. Maybe you didn't use that word, but
I think I did.
yeah, organizing your living area can help you to process life a lot easier. So
Yes.
yeah, so that kind of was like, okay, Judy's telling me to clean up my house.
Oh gosh. I mean, actually, it's more for, I work better when there's no clutter, but I'm very particular about that kind of stuff. But it's also for the client, because if they come in and see a lot of clutter, all kinds of stuff on your desk, or that is going to be too stimulating for them. I also think people like Peggy, like me, I don't know about the other people who live alone, it is more challenging to get the right stimulation, the right social skills, the social stimulation that we had previous to the pandemic. So it's something that we have to make ourselves do, make ourselves go places and make ourselves learn. Whereas prior to the pandemic, those things happened naturally. So
Yeah,
I think
I think Charlene there's some kind of class or something that's coming up about stepping out, or
Yes.
right?
It's actually a panel discussion. It's going to be held on the 29th, next Thursday, at 1 o'clock. And we're going to be talking about getting back out there, how to begin socializing after the pandemic. And it's also going to have some information on elder abuse in it as well. And it's open to the public. So if any of you all are willing, just come on down. We'll greet you and hope you will and learn something. We have a broad spectrum of panelists. We have Maggie Black and the health department, Shore Neurocognitive. We've got DSS, Upper Shore Aging. I know I'm forgetting some. I was trying to do this off the top of my head, but it's going to be very interesting. 1 o'clock here at the Senior Center.
that is awesome. That's awesome. Yep.
Thank you,
Okay.
Peggy.
Yeah. No, that's so important, is getting all that stimulation. Yep. Awesome. Well,
Judy.
Yeah.
I appreciated the association prompts, because these are the things that I do, but I was kind of internalizing them, like it's just me. Like I have to do these things for myself. But if I get my outfits ready the night before, or even plan, it's so relaxing to even go to bed and know that I've got that all lined up.
Yep.
The hearing aids, I've moved my hearing aids upstairs by that bathroom, because that's where I finish getting ready, and then it's like right there. And the same thing, I put my keys, because I have a bracelet, and I put it right on the doorknob, because I've got slacks that don't have pants, that don't have pockets.
Yeah.
It's so frustrating, and because it's bad enough, like Ann was saying about the phone, let alone to try to figure out where your keys are. And then writing things down. I'm always making notes. I always got yellow stickies, but then I put the yellow sticky by the door that I'm going to be going out. And I was kind of taking it like, gosh, why am I having to do all these things? But I think sharing that with other folks as ways to just know that it's part of what we need to do to get rid of the clutter in the brain. I have enough clutter in my house, but clutter in the brain, to make it peaceful. And the big thing is, even though they put those handicap handles on your doors that are supposed to be helpful, well, I caught my pocket on it and almost launched myself off 4 steps. So it's concentrating only one thing in one hand and the rail for the other. And I think we kind of downgrade ourselves, and it's not. It's being really proactive for our balance and the health that we want to keep.
I think you are so right. And I've been known to put a sticky note on my steering wheel.
Mm-hmm.
If somebody asks me to bring something, I'm like, okay, I'm going to write it on the sticky note, and I will not get out of my driveway without doing it. Those are all things that help us.
Yeah.
The one thing that I have found, because my life has become very complicated with all the Chesapeake Forum things, is that, you know how we all have a little calendar on our phones and on our desktop? I just go and I put reminders on there all the time.
Yep.
And then every morning I open it up, I look at my schedule, and I go through my reminder. Oh, gotta go do this. Oh, forgot that. I have to do this. So that has really helped me. And it's very easy. It's much easier for me to do that and have them all in the same place than to have a bunch of yellow stickies all over the place.
That's true. And I also do 2 alerts. I'll do alert the day before and an alert like 2 hours before. And it's great because the more things we get involved in and the more cluttered our schedules are, it's one thing you don't have to worry about. Did I forget about something today? You don't have to worry about it because you're getting a reminder, you're getting an alert.
Yeah,
That's
I
a
have
great-
found with our Chesapeake Forum classes, I've been very surprised how much people use our reminders.
Mhm.
That the Zoom is in there so they don't have to remember where they left it. I would not have guessed that when we first realized that we could do that. So I'm glad that that's becoming a helpful thing.
Reminders are always very appreciated.
Yes,
Yes.
I
Yes.
appreciate those, yes.
Yep, totally agree. All right, well, that's the end of our time, and I hope some of this was helpful, and
Oh, yeah.
I really enjoyed listening to all your comments. That really helped. Thanks to all of you for your input.
Thanks
Thank you.
for a great